Hi, welcome to Learn from the Case. How are you? Today I want to start talking about migraine. I will talk about this topic in several videos because in a single video it gets very long. I estimate there will be 5 videos. So here I make a first approximation to migraine. Here I will make a first approach to migraine-type headaches. It is a common cause of disability and sickly day. The most common type of migraine is without aura. This type is about 75% of cases. Migraine can be classified into subtypes according to the Headache Classification Committee in the International Headache Society. These subtypes are migraine without aura, which is a recurrent headache attack of 4 to 72 hours, typically unilateral in location, pulsating in quality, moderate to severe in intensity, aggravated by physical activity, and associated with nausea and light and sound, photophobia, and phonophobia. Migraine with aura has recurrent, fully reversible attacks lasting minutes. Typically, one or more of these unilateral symptoms, visual, sensory, speech and language, motor, brainstem, and retinal, usually followed by headache and migraine symptoms. These symptoms precede the headache attack, as if announcing that the headache is coming. They are prodromal and are known as aura. This aura exists in migraines and in some patients with epilepsy. I mean that both migraine and epilepsy can occur with or without aura. Chronic migraine is a headache that occurs in 15 or more days in a month for more than 3 months and has migraine features on at least 8 or more days in a month. Sometimes, in some cases, migraine becomes complicated. And what are these possible complications? Here I will mention some possible complications, some more frequent than others, that can be important to remember. So let's see. Migraine complication or complications of migraine. Status migrainosus is a debilitating migraine attack that lasts more than 72 hours. Persistent aura without infarction is an aura that persists for more than 1 week without evidence of infarction on neuroimaging. Migrainous infarction is one or more aura symptoms associated with brain ischemia on neuroimaging during a typical migraine attack. Migraine aura trigger seizure occurs during an attack of migraine with aura, and a seizure is triggered. Probable migraine is a symptomatic migraine attack that lacks one of the features required to fulfill the criteria for one of the above and does not meet the criteria for another type of headache. Episodic symptoms that might be associated with migraine. Recurrent gastrointestinal disturbances are recurrent attacks of abdominal pain and discomfort, nausea, and vomiting, and might be associated with migraines. Benign paroxysmal vertigo has brief recurrent attacks of vertigo. Benign paroxysmal torticollis is recurrent episodes of head tilt to one side. I also want to mention in this video the International Classification of Migraine. According to the International Classification of Headache Disorders, ICHD3. Migraine without aura, headache attacks lasting 4 to 72 hours, untreated or unsuccessfully treated. Headache has at least two of the following characteristics: unilateral location, pulsating quality, moderate to severe pain intensity, aggravation by or causing avoidance of routine physical activity, walking or climbing stairs. During a headache, at least one of the following: nausea or vomiting, photophobia or phonophobia. Migraine with aura. One or more of the following fully reversible aura symptoms: visual, sensory, speech and language, motor, brainstem, retinal. At least two of the following characteristics: at least one aura symptom spreads gradually over 5 or more minutes. Two or more aura symptoms occur in succession. Each aura symptoms lasts 5 to 60 minutes. At least one aura symptoms is unilateral. At least one aura symptoms is positive. The aura is accompanied or followed within 60 minutes by the headache on 8 days or more per month for more than 3 months, fulfilling any of the following criteria: B1B and B1C for migraine without aura, criteria B2A and B2B for migraine with aura. It is believed by the patient to be migraine headaches at onset and relieved by a triptan or ergo derivative, not better accounted for by another ICHD3 diagnosis. In case of severe acute headache, especially if it is the first or worst episode, one should always rule out subarachnoid hemorrhage. Remember that. And what can happen if you suffer from migraines? What is the prognosis? A migraine is a chronic condition that can revert to episodic migraine in 26 to 70% of patients. Prolonged remissions are common. However, some patients have a pattern of living and returning to chronic states. In women, the severity and frequency can increase during puberty, but continue to climb until 35 to 39 years of age, decreasing later in life, especially after menopause. And well, I leave you with this for now. As always, I want to invite you to leave me your comments if you have anything to add or if you have anything to ask. The next video of migraine is coming with more information. Thank you for your attention and be well.